The number of coronavirus cases and deaths in the U.S. appears to be leveling off. Experts say it's due to a natural progression of the virus and not a result of vaccinations. The country is now averaging about 170,000 new cases per day. That is 80,000 less than the peak 2 weeks ago. Monday, California announced an end to regional stay-at-home orders and a 10 p.m. curfew. The CDC says that as of Saturday, over 20 million doses of coronavirus vaccines had been administered. That's about half of the total supply distributed to states. A majority of people have only received their first of 2 shots. Meanwhile, health officials are keeping an eye on 2 highly contagious mutations. The UK variant has been discovered in at least 21 U.S. states. A second strain circulating in South Africa has yet to be reported here in the U.S. In an effort to stem the spread, the Biden administration has renewed travel restrictions on several countries, prohibiting most non-U.S. citizens from entering the country. For more, let's bring in Carl Zimmer. Carl writes the Matter column for the New York Times. He's also the author of the book, A Planet of Viruses. Carl, welcome. I'm really glad that we have you today. What do we know about these mutating strains, and how are drug makers responding?
The first mutating strains, the variants really, we should call them, emerged in December. They started coming to light first in the UK and then elsewhere. And in the United States, scientists became very concerned whether they were here because, for one thing, some of them seem to be able to spread more easily than others. And there are concerns that they might be somewhat more lethal and may be able to avoid the vaccines that we've designed for the original versions of the virus. And this is kind of what you expect in a pandemic. You know, we have lots of mutations. Viruses are going to find a way to get better at what they do.
And the bottom line, Carl, it's still too early to draw any conclusions, though, right, on the things that you just pointed out, on whether or not the variants are more deadly and whether or not the actual vaccines that we have are effective against these variants.
The research is pretty early. There's a lot to find out about these things, and we've only been aware of them for a couple of weeks. So it is clear that at least some of these definitely are more contagious than others. So you have maybe a 30% chance, better chance of being infected by it than by another variant. And you know, the question of whether some of them are more lethal, that has to be studied more. And there is some preliminary evidence coming out that the South African variant, which is known as B1351, might actually be a variant against which vaccines are a little bit less effective.
Well, Carl, on Sunday afternoon, White House officials met virtually with a bipartisan group of senators to discuss President Biden's coronavirus relief plan. What's the main focus, and what are the potential sticking points?
Well, there's a lot of money that they want to push out to people. They were talking about $2,000, and there's been a lot of debate about whether that should be going to everybody or maybe limited to people who, you know, make perhaps less than a couple $100,000, something like that. On the other hand, in terms of preparing for this pandemic better, there's a lot of money there for improving vaccine distribution basically from beginning to end, from getting the supply to getting it into people's arms. The Biden administration has been complaining that the Trump administration really left them with not much of anything in terms of a plan. They're not even quite sure exactly how many vaccines they have and where they are. And so a lot of this money would go to basically getting this vaccine distribution on its feet.
You mentioned, Carl, this question of supply. Here is the new director of the Centers for Disease Control, Rochelle Walensky, responding to a question about the nation's vaccine supply. Let's listen.
One of the biggest problems right now is I can't tell you how much vaccine we have. And if I can't tell it to you, then I can't tell it to the governors and I can't tell it to the state health officials. The fact that we don't know today, 5 days into this administration and weeks into planning, how much vaccine we have just gives you a sense with the challenges we've been left with.
Carl, I'm curious what you make of that answer, and how does this impact President Biden's target of administering more than 100 million doses in 100 days?
Situation to be in. We have put, $10 billion or so into developing these vaccines. They work quite well. And now the distribution of it is turning out to be a real stumbling point. And hopefully the CDC is going to be able to get this under control and be able to move out vaccines moving forward. But a lot of experts say that 100 million doses in 100 days is it's plausible. I mean, it can be done. And in fact, they would actually like Biden to be more ambitious because, with these variants on the loose in the United States, they are going to perhaps create a new surge, and we need to get ahead of that with vaccination.
On vaccine development, the pharma company Merck announced it is abandoning work on 2 vaccine candidates after they failed to prompt a strong enough immune response to be effective. What is the status of other vaccines in development and when they might hit the market?
Well, it was a real, disappointment that Merck, a really big company with a lot of resources, was not able to get a vaccine to produce enough immune response. And we've had other big players like Sanofi get disappointing results as well. This is not an easy thing to do. But we're hoping to see what Johnson & Johnson has. They've had a big effort on a vaccine that could potentially work as a single dose, as opposed to the 2 doses that are Moderna and Pfizer. So that will probably be the next one on the radar. And then after that, perhaps another one from Novavax, which showed really promising signs in early trials. We'll just see if they're able to manufacture them at the scale we need to meet the demand.
All right, so many Americans hoping that that comes through. Carl Zimmer for us. Carl, thank you very much.
Thank you.